This week, we're talking about something called biblical medical ethics. And it's a thing that I had never heard about until I read your work this week. And on that note, everyone out there, if you're not subscribed to Andra's Substack for such a time as this, go subscribe now. We can wait, or you can pause and come back, or you can just subscribe after the show. That's probably even the better idea. But I want to just start with this concept called biblical medical ethics, because it we've all heard stories and told stories, and we all had a friend who had a cousin whose parents wouldn't let them get treated for a particular illness or disease because they had a certain core belief system and they thought God would treat them, and it always sounded like at least to us normies, right? A kind of like edge case or mythological story that none of us really knew about. But this week, you've really brought receipts on what this system is actually doing, and it has legs that extend to RFK Jr. and folks like Todd Blanche. The medical community is not what you think it is. So let's start with biblical medical ethics and then branch out from there. What is it?
Biblical medical ethics is taking the white Christian nationalist view of the body, healthcare, mental health care, and really, quite honestly, how society ought to be ordered and run and function, and applying it to healthcare decisions, how healthcare is administered, who gets healthcare and who doesn't. This particular group that I'm studying, they've written a manifesto. They published it in like 1987. This group came out of a conference in 1978 about the inerrancy of the Bible and what was happening with the horrible liberal takeover of our government back when the moral majority and things like that were forming. And so this group of white Christian nationalist doctors decided to define what biblical medical ethics would look like. I won't say that the Heritage Foundation used their manifesto to craft Project 2025 and Saving America by Saving the Family, which we've talked about on this program a bunch. But I will say that the tenets in this particular manifesto are commonplace across the white Christian nationalist sphere, whether we're talking about Catholic, extremist, white Christian nationalist, or Protestant or non-denominational. You certainly see this kind of thing with Christian Scientists, even more extremely, Jehovah's Witnesses, and that kind of thing. So what we're talking about, as batshit loony as it sounds, is commonplace Christian nationalist beliefs. So I want to say that right up front. When we talk about politicians like Ted Cruz, Mike Johnson, J.D. Vance, Marsha Blackburn, Steve Scalise, Josh Hawley, when we talk about Alliance Defending Freedom, when we talk about people like Leonard Leo and the Federalist Society, these are the biblical medical ethics that govern how they are approaching reshaping healthcare in this country. So this isn't a fringe group of crazy loony people. I want everybody to understand this is what is guiding every change they're making to healthcare in the United States right now. And that's great for private equity. It's great for their billionaire overlords because they can just make more money. So this is going to sound crazy, but please understand, lots of people in power subscribe to this stuff. And I want to say that right up front.
And as I was reading it, I was like, well, this is anti-enlightenment, it's anti-science, it's anti all of these things. And I don't know that they would disagree with that.
They don't. They are anti-enlightenment and anti-science. The Bible is the ultimate science book. I wrote that in 2024 when I was covering Project 2025 and saying they will cut the VA, they will cut the ACA, they will not allow drugs and things like that for mental health care because they believe mental health issues are caused by sinful choices and demon possession. So they're not going. So I was covering all of that and warning Americans not to vote for this. But I was a crazy, ridiculous, hysterical harpy, and here we are.
You're our crazy, hysterical harpy. I and we love you for it. But it's quotes like these. We deny that perfect health is possible except for the state of believers in heaven, right? So I want to talk about the sort of practical applications of this biblical medical ethics, right? Because it's not just like, well, you got to believe. It is actually trying to put belief and biblical belief in the practice of medicine.
Yes.
And so that, like you said, medical problems are very frequently caused by personal sins. And this, I want to get into some of the sort of bigger social issues that this kind of thinking causes shortly, but I want to just talk about, what does this mean? You go to your doctor and they are a doctor at a Catholic medical institution, which, by the way, 1 in 6 healthcare facilities now are religious healthcare facilities. Is that right?
No, it's 1 in 6 beds.
Whoa. Okay.
Are Catholic, and 1 in 5 are religious, because Baptists and Presbyterians, and they own healthcare systems also. But if you take a step back from that, one of my readers who lives in Texas yesterday said every hospital south of I-10, which is 800 miles across southern Texas and encompasses Houston and San Antonio and El Paso, every hospital south of there is a Catholic hospital. But even if it's not a religious hospital in the United States anymore, you still have hospitals applying these principles to populations. When I lived in South Carolina, the Medical University of South Carolina was my medical care facility. It's what came with my husband's job and our insurance. And so that is South Carolina's teaching hospital. It's funded by the state. The state legislature are a bunch of white Christian nationalists, and so is Governor Foghorn Leghorn. So that's what we call Henry McMaster there. So, they passed all kinds of rules that tied funding for the medical university to white Christian nationalist principles that are in this document. And the medical university caved and gave into that. So if you live in a red state with a teaching hospital now, it's highly likely that it's more than 1 in 5 beds that are being religiously influenced, because it isn't just religious institutions that are doing that anymore. It's also red state legislatures and increasingly our federal government in the form of the DOJ and the Office of Management and Budget, which we're going to talk about later in the broadcast. So 1 in 5 may sound like a lot to some people, but it's probably more than that when we drill down.
Right.